Inc. is helping you start your day by talking about the biggest stories of the day. You're listening to Good Morning Hamilton with Rick Zamperin on 900 CHML.
Santa says vaccination against COVID-19 is the best way to keep schools open. This, as a group of medical experts in Hamilton get set to hold an event this afternoon to discuss the return to school. And that's the focus right now here on Good Morning Hamilton on 900 CHML. Joining us to discuss this is Dr. Dennis DiValentino, family doctor and an assistant clinical professor of family medicine at McMaster University. Dr. DiValentino, good morning. How are you?
Good morning, Rick. I'm good. How are you doing?
I'm not too bad. It's the question that every parent is asking themselves: are our children going to be safe in school? I know every case is different and every school is different, but what's your general sense on how we are going to be doing over the next few months?
Yes, these are some tough questions, and that's why we put together the event today. As you know, we'll be discussing this topic at length at Banty.com/COVID this afternoon, and we'll hear from some really good experts. One is Dr. Martha Fulford, who, as you know, is a pediatric infectious disease physician, who will talk a lot about the safety perspective for children when it comes to return to school. And then we've got Dr. Krista Boylan, who is a specialist, a pediatric psychiatrist, and she's going to help us understand a little bit more about the implications of not sending kids back to school and what that might mean. And so I think it's important, Rick, when we talk about safety for children, that we expand the discussion past safety with respect to COVID, and we start talking about broader safety and start including things like well-being and our children's overall health.
So in saying that, and back to the original question, is there a confidence level among physicians that we're doing this correctly and the kids will be safe?
Well, I think that it's time in the pandemic that we have to start shifting from a sort of exclusive focus on COVID safety, as I said, to a more broader discussion. And so it's very, very difficult to suggest that the current path will produce absolute safety. We just think it's almost certainly better than the alternative.
Our children's mental health has been front and center throughout the pandemic, as we know, as feelings of isolation, anxiety, depression have risen amongst the student population. Have you noticed more and more kids reporting these symptoms in Hamilton, or has that been leveling off?
That's absolutely not been leveling off. I think that's something that's ramping up and increasing the concern. Some of us on the front line who are hearing these things from children. And of course, we're very familiar with mental health discussions, but the age at which we are starting to have them and the types of discussions that we're having is fairly concerning. And very young children who don't see hope for tomorrow. And we know that when it comes to mental wellness, a positive outlook and hope is the number one thing. And to be taking that away from children and hearing them describe that quite articulately at the age of 7 or 8 is really what's ramped up our concern and caused us to move forward with an event like today and other similar discussions.
So what can parents do at home if their child is expressing these feelings?
So we'll hear from Dr. Boylan today, and as I said, she's a pediatric psychiatrist who will talk a little bit more about how to deal with some of the negative consequences, and of course, what the positive things that we know can help children. And one of the things that I would suggest in terms of answering your question is there's not a lot of great things that we can do if we don't allow for the proper social development. And so I think parents should focus on obtaining that again for our children, what we call putting these kids back at the front of the bus and allowing them to do the things that are really the substance of the answer to your question. Social engagement with family and friends and other things that promote this proper social and interpersonal development.
Our guest on Good Morning Hamilton on 900 CHML is Dr. Dennis DiValentino, family doctor and an assistant clinical professor of family medicine at McMaster University. We're talking about kids going back to school and whether or not they are safe. 46% of children aged 5 to 11 in Hamilton have received at least one dose of the COVID-19 vaccine. 10% have had 2 shots. Are those encouraging numbers?
Well, I have a slightly different take, and I'll go ahead and discuss it. possibly at my peril, but I'll do so. And my take is that I do not think that the vaccine should be the center of return to school for children. I think that we are not seeing the evidence that we had hoped for in terms of reduction in transmission, and that's what we're talking about when we're talking about making the school safe. Is there a risk of significant transmission? I think there is, whether we employ the vaccine or not. And so I don't find them to be encouraging numbers with respect to return to school, because I don't think that's what we should be focusing on.
Dr. DiValentino, we have a live event, as you mentioned, later on today. It's called Let's Kids Be Kids. It happens, at least for the general public, from 4 to 5:30. And you mentioned the website, Banty.com/COVID. Free to register. What are some of the things that parents and those who are intrigued by what's happening in schools will learn today?
Okay, so we will talk about, Dr. Fulford will talk about some of the evidence around, the extent of COVID and what some of the testing numbers that we have been hearing over the last couple of years really mean for the community and for the hospital. And she'll talk a little bit about the efficacy of the vaccine and in which groups that we're seeing the greatest benefit of the vaccine in, and therefore who should we be looking at deploying further vaccination strategies? Which group should we be looking at in terms of doing that? And just try to put it in perspective in terms of risk to children and what benefit children may get if their parents choose to provide them with this vaccination. And then we'll look at some other interesting things that I think parents are are very interested in, such as the use of face masks, particularly in schools, and does this reduce the risk of transmission or make our children safer in any way?
Well, as we know, knowledge is
subjects.
As we know, knowledge is power, and we'll get a lot of knowledge later on today with this free Let Kids Be Kids event. Dr. DiValentino, appreciate the time today, and good luck with the event later on today.
Yes, thanks for having me on, Rick. Greatly appreciate it.
That is Dr. Dennis DiValentino, family doctor and an assistant clinical professor of family medicine at McMaster University.